Thanks everyone for joining today. I'm Michelle Damian with IAD, and I'm here with Rob Roberts from Priority Health. And we are going to be talking about the DSNP plan today. And I'll let Rob take it from here.
Well, thank you, Michelle. Appreciate that. Hopefully, everyone can hear me. And let's share my screen. Yeah. So Michelle indicated, we're going to be looking at maybe a half hour, so I can stay on beyond that, answer any questions that you might have. I will say that this presentation generally an hour, so I'm going to breeze through this at a relatively high level. Anything that you want me to kind of come back to at the end and answer question wise or spend a little more time on, I'm very happy to do that. So that's not a problem. I do have time beyond the half hour that's allotted here. So we'll get started right away. Just wanted to put in here a couple of reminders regarding DSNP. So I don't know the experience of the agents that we have on the line here, but the DSNP population is, these first few slides just kind of define what the majority of those beneficiaries look like. And this slide really kind of hits home. I was really surprised by some of the numbers that I saw here. 48% have at least 7 chronic conditions. That's amazing numbers. I don't want to read through each of these, but just point out a couple of things that, this is a protected class. There is a need here for assistance. This is a very complicated product that we've chose to sell and advise our clients on. And, there certainly is a need within the DSNP community of that service. So DSNP eligibility for Priority Health, just as a quick reminder, we have 2 plans now as of 2023. Our traditional DSNP plan that's been around for some time now and is available in all 68 counties in the Lower Peninsula. I believe there's 68. For us, they do need to be enrolled in Parts A and B, of course, 21 years of age or older, and be full eligible DSNP. So that would include Quimby Plus, Slimby Plus, or full benefits dual eligible. And that is the case for both of our plans. The only difference here with the Kroger plan is that the footprint, as you can see here, is much smaller, and it is new to 2023. Just kind of a broad overview, though, real quickly between the 2 plans themselves. If you do find a beneficiary that falls within the 8 counties listed here in Southeast Michigan, probably going to want to focus on the Kroger plan, just some slightly enhanced ancillary benefits from our traditional Priority Health plan. One example of that would be the dental. The Kroger plan has $3,000 of dental, where the Priority Health has $2,500. Just a slight nuance there. Just as a reminder, we being Priority Health, do have a Medicaid product. The state should enroll the beneficiary in our Medicaid product if the beneficiary resides in the counties that you see here. If they don't reside in these counties, they would simply fall in the state program, the fee for service. I'm told that there's been some issues with the state assigning the Medicaid carrier with the DSNP product. They should be doing that with each carrier that offers a Medicaid product. Like I said, I'm told that that's been lacking as of late, as well as the assessment, the annual assessment, as whether or not somebody qualifies. I'm told that's going to be picked up again this year, now that we're through kind of the COVID pandemic, and that was the excuse that I was given as to why that had fallen off. So we'll see if that continues this year, or I should say gets picked back up again this year. But one example as to reason why you might want somebody on our Medicare or our Medicaid product who is on our DSNP product is the coordination of care. We have great team members. We call them care managers, and they do a phenomenal job. They're very not only reactive, but they're actually proactive when it comes to making sure that that your client receives the care that they need for best outcomes. They just do a phenomenal job. Quick reminder here in regards to the benefit design. Of course, any liability after Medicare is billed gets sent to Medicaid. That takes care of any of that remaining liability. So good looking plans. The DSNP, of course, our Kroger DSNP looks the same. So podiatry services, this was an ask that I just wanted to throw in here. So podiatry services, we do cover a couple of different ways. So Medicare, we do have Medicare covered services at a zero copay, and that would be for routine foot care with a diagnosis or an injury or disease to the feet. So something like that's not supposed to be happy toe, supposed to be hammer toe, or heel spurs. Apologize about that little clerical error. Or medical conditions that affecting the lower half, right? Like diabetes. So Medicare requires 6 nail debridement visits and 6 callus removal visits a year, and that is at a zero copay on both of our DSNP product. But beyond what Medicare covers, we also cover a non-Medicare covered at a zero copay routine foot care, where the beneficiary can self-refer up to 6 visits a year without any medical condition. So kind of a differentiator there. And I'll get those clerical errors updated. Also, the new Abridge. This is a new benefit on all of our plans, including the DSNP. This is a great benefit. The example that I give is my mom was battling lymphoma down in Florida, and this would have been a great benefit to have for her. Anybody in that position, following a doctor's appointment, you give them a call and, how did it go? Oh, it went fine. What'd the doctor say? I don't know, this type of thing. And the Abridge benefit that we now have on all of our plans is an app, a phone app based benefit. And basically, it will record the doctor's appointment or meeting with any medical provider that you might have, will dictate that conversation that you have with that provider, and then give you the ability to provide others with access to it. So in my case, it would have been great if my mom had this benefit, in that she could have shared that doctor's appointment with me, either through dictation or recording. It'll actually highlight diagnosis, prognosis, prescriptions, all those different types of things that when you're sitting there talking to the provider, maybe, they don't hit home well enough to where you can remember and communicate that to a loved one. So this is really nice benefit. So dental, vision, and hearing, I had mentioned earlier in regards to the dental, our traditional DSNP has $2,500 of dental. The new Kroger Priority Health Kroger DSNP has 3,000. That was just one example that I gave as to why, if a beneficiary resides in one of those 8 counties, that you might want to lean towards the Kroger DSNP. Vision is $200 allowance in eyewear, and hearing, we use True Hearing, where they get 1 hearing aid per ear per year, which includes mold, batteries, and unlimited visits. And I'll get into a little bit more detail here. We do use Delta Dental, including in our DSNP, and this is one of the, I think, the differentiators when it comes to DSNP and Priority Health and all the other carriers out there. I really do. The way I kind of explain it to agents is, a lot of carriers try and buy business, right, with this outrageous ancillary benefit levels, but quite often it's difficult to access, right? It might look really good on a spreadsheet, beneficiary might come to you and ask for it, but it's not always easily accessible, right? And that creates frustration, which can lead to, which could lead to, loss of clientele and kind of spinning your wheels, so to speak. We take a much different approach at Priority Health. Even in our DSNP category, we have a much more stable product. We don't buy business. And one of the really differentiators between us and others is the access to care, whether it's our provider directory, which is the exact same provider directory for our DSNP as it is for our HMO POS and our PPO product, or the ancillary vendors that we use, in this case, Delta Dental, iMed, True Hearing, right? So the ancillary benefit levels might not be quite as high as some that are out there, but the beneficiaries can access it, and our retention rate is 12% higher, and that's for a reason. So if you're tired of kind of spinning your wheels and you're looking to grow your book, we're a great carrier to kind of team up with to do that. I believe this was one of the reasons why we actually surpassed Blue Cross Blue Shield in recent years, is because of our retention rate. Once you put somebody with Priority Health, they stay with a lot more frequency than other carriers. So just a couple of things to point out there. The dental, as far as what's covered, the screen's been up for a little bit here now, so I don't want to just kind of read through these, but a pretty comprehensive dental benefit that you can see there. I will say 4 cleanings, the periodontal procedures, also including the scaling and the root planing. So let's see what else kind of fillings, crowns repair, simple extractions, dentures, realigns and repairs of bridges and dentures. So just a really solid dental plan. Vision, as I mentioned, iMed, $200, zero copay for reimbursement for vision. They don't have to go to an iMed beneficiary. We do have a claim form for reimbursement. True Hearing, though, for our hearing benefit, they do need to go to True Hearing and reach out to True Hearing to schedule those appointments. It is a zero copay. They do get, for that zero copay, advanced hearing aids, 1 per ear per year, and that does include the molds if that beneficiary elects a hearing aid that requires mold. So they get a 60-day trial period. It also comes with 80 batteries per hearing aid, and then a 1-year unlimited post-purchase follow-up visit, right? So they can continue to go back that full year if there's a mold that needs to be done, if it's not quite fitting just right. Again, we kind of talk about that access to care, making sure the beneficiary is happy. Yeah.
Rob, real quick,
Yep.
going back to the beginning of the webinar, you showed a map with the pay fee for service. That didn't
Mhm.
make any sense to me. I want to make sure we've got this correct in terms of the area of network is all of the 68 counties. So
Yep.
can you go back to that? Because that map showed there was a fee for service, which I would have thought
Yeah.
that that would not be the case.
Yep. So I think what you're getting at here, Michelle, is the footprint of our Priority Health DSNP product. The beneficiary can actually reside in all 68 counties to
Right,
enroll in our DSNP product for Priority Health. Our Priority Health Kroger DSNP product, so we have two. It's a smaller footprint. The beneficiary would need to reside in these 8 counties in Southeast Michigan. So
correct.
that's to enroll in the DSNP. Now, separately, we have a Medicaid benefit. Now, when a beneficiary enrolls in either our Priority Health or our Kroger DSNP products, depending on where they reside, if they reside in one of the green counties here, they would also be enrolled in our Medicaid benefit, not just our DSNP product.
Oh,
Okay. So the
thanks for that.
DSNP being the DSNP being the Medicare benefit, the Medicaid benefit would be the Medicaid benefit, obviously. If the beneficiary resides in these green counties, we would also administer the Medicaid benefit. If they live outside of these green counties, they would fall into the state fee for service Medicaid benefit. Not a big difference, really. It's just a matter of who administers it. Think of it as a MAPD plan without being in every county, right? Where we are available, the beneficiary should be enrolled in our Medicaid benefit. If it's a county where we don't offer the Medicaid benefit, they would simply reside or they would simply be administered by the state Medicaid benefit. So no real difference there in the eyes of the beneficiary other than case management. We would have simply one case manager for those beneficiaries who are enrolled in our DSNP and Medicaid benefit. Does that make sense? So look at it this way. There's two benefits. There's the Medicare and the
Yeah, sorry, I
Medicaid
was on
benefit.
mute. I
Oh,
was
okay.
there for a minute. Sorry about that. No,
I
that
gotcha.
makes sense. Thank you very
Okay.
much for that.
Yeah, and I can spend a little more time on that too at the end if there's any remaining questions about that.
Okay,
So
thanks for that.
Oh, absolutely. Yeah. So dental, hearing, vision. Let me go back and find where we were at here. Supplemental benefits. Okay. So some supplemental benefits, that are in these plans, transportation, and I'll just kind of focus on where we kind of differentiate. We do use Safe Ride. A couple of differentiators when it comes to our transportation benefit is that also allows us to access Lyft and Uber, and it is door to door, not curb to curb. So those are some differentiators between our transportation benefit and some of the others, that are out there. In regards to over-the-counter allowance, the Priority Medicare DSNP. So this is a benefit that will vary slightly depending on if it's the Priority Health DSNP or the Priority Health Kroger DSNP. The Priority Health DSNP, it's $190 quarterly and pretty traditional. We did switch to Convey this year. We did have a little bit of difficulty in switching to the new vendor, which I was a little surprised by. Convey's been around for some time now. Our entire feed wasn't uploaded accurately, so we did run into a little bit of issue there. That's been cleaned up since, but overall, Convey does pretty good job. Pretty straightforward here. You can buy online, you can call to order, mail order, or you can buy in store. We do not roll over our OTC benefit. I think we might be one of the last carriers who doesn't do that, but it is quarterly benefit for $190 on the DSNP Priority Health. The Kroger DSNP looks a little bit different. This is also powered by Convey. Same ways of accessing that benefit. It is a $70 per month. The difference here is that we have the over-the-counter plus, and the plus is in reference to groceries. So on our DSNP Kroger, the beneficiary can also access the Kroger store for groceries for that monthly benefit. Now, this is one of the few benefits that we do have a qualifier for. In this particular case, it's SSBCI. There's 15 diagnoses, everything from hypertension to, oh my gosh, diabetes. There's like 15 diagnoses that would qualify them for that food benefit. If they don't qualify for the food benefit, they still receive the benefit. It just wouldn't be, the groceries would not be included. We do have a link that you can question the beneficiary to determine whether or not eligibility is there. If they're already with Priority Health, we would have that information and be able to, provide that as well. Oh, and this just kind of reflects the SSBCI that I mentioned in regards to the food as well. So any additional questions to that, let me know. I can kind of stay on and kind of read through that as well.
We
Does
do have
anybody
a question about
Oh,
implants
okay.
and if they're covered, which they are at 50%. But is there a waiting period?
No, we don't have any waiting period for
Okay.
our dental.
So, and that's covered at 50%.
Right.
Yes.
Yep.
Okay.
We also include mom's meals. The one thing that I will point out about mom's meals, I think this is a pretty common benefit that you'll see these days, whether it's the DSNP or just the MAPD products. Make sure that the beneficiary understands once they're discharged from a facility, we actually feed a daily discharge report over to mom's meals. And mom's meals will reach out to your client because contact needs to be made before meals can be shipped, right? We have to take into consideration things like dietary concerns, right? What if somebody has an allergy? What if it's a peanut allergy or they're gluten free, or who knows, right? There's a million different dietary issues that could arise. So just kind of work with your beneficiary and let them know that this is a call that they can take. We need to make that contact with your client before meals can be shipped to their house. But it just, a really nice benefit, particularly for someone who might have a need for that, being recently discharged from a hospital, for example. Personal emergency response. This is a little bit of a separator between Priority Health and the rest of the industry out there. I mentioned access to care. This is something that we do not have any qualifiers for when it comes to our DSNP beneficiaries. Every DSNP will receive a personal emergency response. This is a little unique. It's powered by Critical Signal Technologies, and I'm told the difference here is that even if they leave their house, it's not Wi-Fi, it's cellular, so that even if they leave their house and they're outside and maybe they're, with some of these PERS, if it is Wi-Fi based, it's a bad signal and it won't work, right? These are our cellular networks, and so it supposedly works anywhere, which is kind of nice, right? So everyone qualifies for it, works anywhere. And again, these are, I guess, one of the differentiators between Priority Health in providing that access to care compared to, some of the competition out there in regards to the PERS. Low income subsidy, depending on where they're at, what category they fall under. There, you can see their copays listed here. This is an area where you have access. I guess we provide the resource by calling the 800 number. We will provide you with whether or not they're eligible for our DSNP product, what LIS category that particular beneficiary falls under, so that before going out and speaking with that beneficiary as to what their benefits are going to look like. Insulin vaccine coverage. I did have a list here, and Michelle, I can provide you these. This provides you the list of zero copay insulin and vaccine shots. I will send that to you as well. Here is Papa Pals. As Michelle was mentioning, I don't know if everyone was on, we were kind of having a brief conversation about this before we got started. This is one of my favorite benefits. And what I love about it is just the variety of benefit that your client can receive from Papa Pals. The Abridge benefit that I mentioned before. One of the things that I recommend to agents is have the beneficiary reach out to Papa Pals, set up their account, and have a Papa Pal come out and set up all the technology, right? So many of our benefits these days are app based, are technology based. Technology is one of the areas that your client can receive help with, right? Whether it's changing the clock that's flashing 12 on the microwave, or remote controls, or downloading app that will give them the benefits, all the benefits that they can receive, whether it's with Priority Health or whoever. Obviously, the more benefits that your client accesses, the happier they're going to be, the more likely they are going to be to stay, etc. But this is just a short list of some of the benefits that your client can receive receive through the Papa Pals benefit. So household chores, transportation, which is another great one. No limit to number of miles or trips. It's just an hourly benefit. We did remove the monthly benefit and made it an annual benefit, giving the freedom if a beneficiary is discharged from the hospital and have a higher need for 1 month over another month. So we wanted to make sure to provide your clients that flexibility. It also comes with unlimited pop-up care concierge. That includes things like anything from explaining an explanation of benefits to scheduling a doctor's appointment to maybe there's some social programs out there that your client qualifies for. The concierge, the unlimited concierge can assist with all those things. So it's just a great benefit. I love the variety of benefits that your client can receive from it. I actually have had a few agents sign up to become Papa Pals after discussing this benefit. They love it. A couple of them weren't able to do it because they had enough Papa Pals in that particular area, but just a really cool benefit. Silver sneakers, pretty traditional, nothing to really spend a lot of time on here as we're wrapping up. Tools and tips with 3 minutes left. Let's see if I can do this. So I mentioned the 800 number to call to see if a beneficiary qualifies. Here's that number. We would need the Medicaid ID, date of birth, first, last name, and MBI number. If you provide that, we'll be able to let you know if they're eligible for our D-SNP product and what LIS category they fall under. Enrollment, the grace period. This is pretty important. The grace period, if someone falls out of eligibility for the D-SNP product, we recommend that you immediately enroll them into an MAPD plan, because what happens is they'll fall back to original Medicare. They would still receive all the ancillary benefits on the plan that you've enrolled them in within our D-SNP. However, the medical coverage wouldn't be listed at 0 anymore. It would fall back to original Medicare during that 6-month grace period in determining whether or not they're still eligible. So we immediately recommend that you enroll them in an MAPD plan, which you could do due to that loss of coverage. It would be an SEP. Loss of LIS as well, and this is what the prescription coverage would fall to. So it's not just the Medicare coverage. Preferred DME providers, J&B as an example, have the beneficiary reach out to one of those DME providers for things like diabetic supplies. They will reach out to the provider and ship those supplies to your client's doorstep. In-home health assessment, these are really important. What these do is, along with the health risk assessment, these help us in determining and using our care managers to determine all of the programs that are available for your client to get them enrolled in those programs so we can get best outcomes, right? So the more contact that we have with the beneficiary, the better job we can do and our team can do to make sure that they get best outcomes. Provider network, this is a huge differentiator between us and the other D-SNP market. Our D-SNP provider directory is the exact same as our HMO POS and our PPO. In Michigan, we do not require referrals to see in-network specialists. It lists here 9 of 10 primary care providers. It's actually higher than that in every major hospital system. So if they want to go to Henry Ford, they want to go to Beaumont, they want to go to U of M, St. Joe's, doesn't matter. They can go see them. The only hospital that doesn't participate it's over in the Thumb. It's like a 135 bed hospital, and I always forget the name. But unless you go to that hospital, I actually had a conversation recently with an agent who said they were familiar with that hospital, and they said it's probably a good thing they're not in the network. I don't want to say that, but so again, this really gets back to the access to care that we preach about at Priority Health. We don't buy business. We have very stable products that increases retention because we allow your clients to access the care that you've sold them. Provider directory is just one example of that. Agent resources, I don't want to spend a whole lot of time on because we're at our half hour. We do have some marketing materials available within the Agent Center that have been CMS approved and Priority Health approved. Those do include our 5-star as well, but these are social posts that you can post. They're already approved. Get some marketing out there. Enrollment reminders. This is something I just touched on real quick, just as a real quick reminder. Enrollment for D-SNP is a little bit different. They can enroll each quarter throughout the year in quarters 1 through 3, and it is first app in as opposed to last app in like AEP. So a couple of reminders there. Getting appointed. All right, so 2 minutes over. My apologies apologies there, Michelle.
Oh,
So
no
let me
worries.
yeah, let me see. I think I have some questions here. Implants, we kind of covered that one. If a provider accepts Medicare but not Medicaid or Priority Health, would they still be able to have coverage under this plan? So this is a great question, Jeff. A lot of providers don't understand that Priority Health, and this is why one of the reasons why we have such a huge provider directory, especially in the DSNP market, unlike other carriers, because other carriers will have a separate contract for their PPO, another contract for their HMO POS, and then another contract for their DSNP or HMO products. We don't. We have one contract for all. And this is one reason why our provider directory in our DSNP is so huge. So yeah, if somebody is on a DSNP and goes to one of those 95% of the PCPs or anyone in our Priority Health network, they can go there. We'll run into this problem on occasion where the provider's office will say, oh, we don't accept DSNP. You do. You accept Priority Health DSNP. You don't accept anyone else, but you accept Priority Health DSNP. So to answer your question, yes, as long as they see someone in the network of Priority Health, which is expansive, the DSNP beneficiary can go there. Absolutely. I hope that answers your question. James, let's see. Can you go back to page 34? And I will do that. Yeah. Can you go back to the slide regarding grace period? Okay. So let's see what slide 34 is. Maybe that's the grace period slide. Yep, it is. So the grace period. So the grace period, now the state hasn't done this in recent years. The state, what happens is the state once a year will assess whether or not somebody is eligible for DSNP. And they haven't done this through COVID the last few years. And so what that means is we may have people that are eligible for the DSNP that shouldn't be, and people who are not eligible who should be, because those annual assessments haven't been taking place. However, when those assessments do take place and somebody might be removed from eligibility, they go into a grace period. When they're in that grace period, Medicaid is no longer billable, okay? So they go back to original Medicare. Now, any of the ancillary benefits that are on the DSNP plan, so like the dental and the vision and the hearing, right? All those ancillary benefits, they would still have access to, but their out of pocket for the medical is going to fall back to original Medicare, right? So you have the deductibles, you have the co-insurance, you have all that out of pocket. So what we recommend you do is if you have a client that falls out of eligibility and into their grace period, immediately move them to an MAPD plan, a zero premium MAPD plan, and that will drastically lower their out of pocket for medical, obviously, right? And then also still retain a lot of those ancillary benefits, that they had. So I don't know if you had a specific question outside of that. It just said to go back to slide 34. Hopefully that answered the question. Any other questions?
Don't see any questions as of yet.
Do we track people who lose eligibility? So we actually send agents a term report. We send them a term report. So once CMS, right? Well, if CMS receives a new enrollment, they will notify the current carrier. We send that report out to our agents. And we do that because we want to give you, the agent, the ability to kind of retain that client. What happened was we got a lot of calls in these auto enrolls. We got a lot of calls in regards to these national phone bank, right? Where it would probably happen once a week. I'd get a phone call from an agent saying that, my beneficiary received cards in the mail. They never enrolled in anything. What's going on? And so we started pushing these term reports out to agents so they can use those to reach out to the beneficiary and have that discussion. Now, you can still do that if that term report gets to you prior to the effective date of the new plan, right? Because they're still your client. But that's kind of the idea behind that. So we try and notify you, the agent, as soon as possible. Once those reports come from CMS, we push those out to you so you can work with those however you see fit. Hopefully that answers your question. I don't know that other carriers do that, to be honest with you. But our goal is to let's grow together. We want to give you the tools you need, to retain your clients.
So how much time do they get before the next plan is effective? What was the time frame that they get this information?
So it depends on when the application is submitted, right? So if the application is submitted on the 30th, for the effective date of the first, we're not going to get much notice, right? If
Mhm.
any, because it's only going to be a day or two. But if it's submitted early in the month, that gives us, that gives CMS time to report that term to us that we can then push out. I don't know what the turnaround time is. My thought is it's not long. It might be a day or two because we really don't filter that at all. We just push it out, and we put with that beneficiary, we put the reason for the term, right? So it could be enrolled in another plan. It could be, I don't know. I mean, there's a million different the different things. But James, can you get with community events? I'm not sure if I know what that means.
I can always reach out to Jim about that. So I will give you a call today. So let's see, any more questions? Okay, all right. So it looks like we are going to wrap this up if there's no more questions. And you can always reach out to myself or Rob if you do have additional questions after this webinar.
Thank you, Michelle. I appreciate the opportunity. Yep. And if there's anything I can do, let me know or follow up on. I will send you these slides with that link as well. And yeah, just let me know what the next one you'd like. Although we might have that already, I'm not sure.
Okay, that sounds
What do
good. And just thank you everyone for joining today and your questions. So we will end the session now.
Thanks,
All
Michelle.
right. Yes, thanks everyone. Bye-bye.
Bye-bye.